A new peaceful beachside hometown for Kelli Reardon.
So I've lived here about a little over 2 years. We just really feel like we're really part of the community out here.
Came with an unexpected surprise.
Well, I was actually shocked when I got it.
When she started paying for diagnostic tests that have become part of her healthcare routine.
And so I was calling family members and like, hey, is this normal? Is this right? And they're like, yeah, that's, it's high, but it's worth it.
The change in scenery from Alabama to North Carolina came with a major change in Kelli Reardon's healthcare bills for an annual breast MRI, something she says isn't optional, but potentially life-saving.
So I'm high risk for breast cancer. So my mom died at 48. So I'm definitely like dense breast, but most women have that anyways. So definitely categorized as high risk. So just being checked every 6 months is super important, especially for me and everybody else in my family.
When Reardon lived in Alabama, she says she received her MRI at an imaging center and was billed around $1,100. Her out-of-pocket cost totaled around $650.
But then moving out here, I just assumed it would be the same. Knowing hospitals are maybe a little bit more just because it's a different type of facility, but didn't expect quite the price change that I experienced with it.
And what was the price change?
So out here it was $12,000. So I was like, oh, okay, no big deal. They made a mistake with billing. They accidentally added a zero.
But it wasn't a mistake. Reardon went from being billed around $650 out of pocket to over $6,000. Consumer medical experts say that's because instead of going to an imaging center, Reardon received her MRI in North Carolina at a hospital facility. For both procedures, Reardon was in-network, received prior authorization, and had the same insurance. She expected the price to fluctuate somewhat, but not this much.
I work in pharmacy, so pharmacy bills real time. So when you come to the pharmacy and you pick up a prescription, that's the price that you pay. There's no back billing. You don't get a bill that says, hey, now you owe an extra $1,000. With medical care, it's all billed after the fact. So I was probably 6 months later that I got this $6,000 bill because it's all back billed.
Unfortunately, before you get care, we don't often know how much it will cost. Unlike any other product you would buy where you know the price tag, more often than not, before a procedure, you don't know.
Kay Pastena is a vice president at KFF in Washington, D.C., a nonprofit health policy research, polling, and news organization.
For private insurance, each employer, each insurer has a negotiated rate with each provider. They have their own provider rate. And that's not often very transparent to patients.
Pastena says where you get your care can make a difference.
Most patients don't know you're often paying more to get that care at a hospital setting because of what are called facility fees. I'm not sure if that's the case in this particular scenario, but often a hospital is going to charge you an extra fee.
Where Reardon now lives, there aren't many options nearby.
An imaging center is not even within 20 miles, 30 miles from you, right?
Yeah, 100, 120. You're talking about driving to Raleigh, which is 4.5 hours from here.
Our team showed the pricing differences to Patricia Kelmar, Senior Director of Healthcare Campaigns at U.S. Public Interest Research Group, or PIRG.
When you saw the difference, what went on in your head? What did you think?
So there's significant differences. $10,000, that is a lot of money. And it's important also for our insurance companies, right? We don't want our insurance companies paying 5 times the amount just because it was done in a hospital setting. And so you have to ask that question. You have to ask for the prices up front.
One way of doing that, Kelmar says, is looking on the center or facility's website for a price estimator.
See if the bill is even close to what they're telling you they're going to charge you. That's a point of negotiation that you could have. It is the law that every hospital put on their website information about prices for the services that they offer. If you can't find that, call them up and ask for it.
Reardon's hospital did not comment on her specific case, but told our investigative team it's important to note that the prices reflected in these estimator tools may not encompass all costs associated with the service and may differ from the actual cost. They added that they recognize the complexity of healthcare pricing and support patients with their billing needs. There are moves in the works to try to make prices more transparent, specifically when it comes to receiving what's called an advanced explanation of benefits, or
AEOB. I think most of us who are consumers know that we get this thing called an EOB. It says this is not a bill from our insurer, and it tells us how much we have to pay out of pocket after we get the service. Federal law will require you get that notice before, but that hasn't yet been implemented. So patients are still kind of on their own to figure out the costs beforehand.
And there is a bill proposed that would eliminate out-of-pocket costs for people like Reardon. The Find It Early Act would provide health coverage with no cost sharing for additional breast screenings for people at greater risk for breast cancer.
Yeah, that would be great. I mean, if this is something that I guess it eventually comes down to our government decides is an important thing to help protect the women. I feel like a lot of times women's health in general kind of lags in care.
Reardon is now on a payment plan, but she worries for other women who are high risk, who aren't as fortunate.
I just feel for people that aren't as lucky as I am. I do have a good job. I have a company that helps pay for health care. I have people that I can talk to. To be somebody that just doesn't know anything, like, it just makes me really feel for people out there that just get the bill, and then, some people that could be the last straw for them.